We're here to make a new type of news.
New insights, new styles, and new topics every day.
We are News Generations.
Making news just for you. It's April 23rd here in Seoul. I'm Shin Yeun, and you're watching News Generation. Joining me in the studio is Walter Lee.
Lovely to be here.
Good morning, and Woo Hee-jun.
Happy Tuesday.
Happy Tuesday. Now, both are here to speak on behalf of people in their 20s and 30s. As usual, let's start with our news feed, which covers different hashtags and news items that have been trending on social media over the past 24 hours. South Korea has the highest smartphone prices in the world. That's according to a recent report from market research firm Tech Insight. The report found that Seoul had the most expensive average smartphone prices for 2 consecutive years, mainly because it is home to Samsung Electronics, and the IT giant has released premium foldable models commanding hefty price tags. The report also mentioned rising iPhone costs. Moving on, a public transportation discount service called the K-Pass card will be issued from tomorrow. The card will be issued with 10 credit card companies, including Kookmin, BC, Shinhan, and Hyundai. Applications can be made on each card company's website. For regular public transport users that use either the bus, metro, or express railways like the GTX more than 15 times a month, 20% of one's spending will be returned. For young people, 30% of their spending will be returned, while the low-income classes can expect 53% back. The K-Pass cashback service will take effect from May. And ending off with news in Gaza, a baby girl was delivered from the womb of a Palestinian woman who was killed along with her husband and daughter due to an Israeli attack last week in the city of Rafah. The baby, weighing 1.4 kilograms, was delivered in an emergency C-section. Her late mother, Sabrine Al-Sakani, had been pregnant for 30 weeks, and the infant has since been moved into an incubator and will stay in the hospital for 3 to 4 more weeks. And the world has paid attention to this tragic story and are keeping their eyes on where this child will go. The violence in Gaza has cost the lives of many innocent people, even infants. Now, I'd like to ask our panelists in the studio what they think about the situation in the Middle East, and in particular, how they first reacted when hearing this tragic story.
Well, personally, I was dispatched to Lebanon as peacekeeping missions in the army, and I'm well aware of this dangerous war in Israel and Palestine states. And a mother who sadly died in the war raid, and she did not happen like this, but the baby in her stomach must live as an orphan in the future. So, and these damaged cases make us more aware of the seriousness of these current situations. And I also think that it is articles that make us think of the numerous missions of UN peacekeeping mission forces in Middle East, and about the international community's duty in this field.
Exactly, and the international community has been calling for Israel to stop with all the airstrikes that have been tackling and attacking innocent Palestinian citizens in the Gaza region. Now, Walter, what are your thoughts on that?
Well, to be more on the side of the story of the baby, I mean, it's sort of like obviously extremely tragic, but yet a miracle at the same time to have, this situation happen. You've got to feel for the family around the woman, obviously, and anyone who's suffered through the unnecessary killings of both sides of the fence. But the fact that this baby seems to be in healthy condition is a blessing. It's just sad that that child will not be able to meet her mother in the future.
Exactly.
So,
The baby, she was born without a mother or a father, which is why a lot of people are very worried as to where she would go. She's an orphan at the moment. Would she go to her relatives? Will she be able to survive? We'll have to keep our eyes on this story. But let's now change gears to our main discussion topic of the day. We're going to be talking about health today, because just because you're young doesn't mean you're 100% disease-free or healthy. In fact, a growing number of people in their 20s and 30s are reportedly being diagnosed with cancer, particularly colon cancer. So we're going to start here. How high are cancer diagnosis rates among people in our generation like these days?
well, if we compare to older generations, I heard that statistically MZers are much less likely to get colon cancer, but it appears, according to studies, that the number for MZers is growing by the day. A doctor within Vietnam, a director from the Young Onset Colorectal Cancer Center, said that there might even be up to a 90% increase by the year 2030. So that's actually just coming up, right? And that's a huge increase in people, MZers, who will be getting this colorectal cancer or colon cancer. Now, I remember we touched upon this in a previous episode that there were certain symptoms that I was looking out for, and I was also very worried. So I went to the doctor and got checked out. Luckily, I had nothing seen, or there was no problems. But it's good to see that more celebrities are coming out and raising awareness of this. Obviously, with the death of Chadwick Boseman from Black Panther, the Marvel series, when he kind of kept it secret, a lot of people were very shocked to hear this news. This is actually not the first time a celebrity has come out and kept it a secret, but now we are seeing more and more celebrities come out and raise more awareness. Olivia King Charles, should I say, and also Kate Middleton has recently come out and talked about it. So hopefully we are going to, talk more about cancer as a serious subject, even though we always have, but obviously raise the awareness as well.
I mean, I remember it was around this time of the year last year when we talked about colon cancer and how common it is among people from our generation. But I think we tend to forget that we are susceptible to diseases like this because we consider ourselves to be youthful and young. But Hyojun, would you like to add on as to how a lot of people from our generation seems to be getting diagnosed with cancer these days?
The cancer was a disease that felt always the distance to me or to our generations, but it seems to be become a relatively familiar disease that can occur at any times. This phenomena is not just for the celebrated moments, but according to the University of the Washington's, the MZ generation was the age groups with the highest cancer incidence in G20s over the 30 years. And Korea is also the young cancer risk country, and according to the statistics by Health Measure Insurance Review and Assessment Service in Korea, the cancer incidence rate among the patients in their 20s has increased by 26% over the past 5 years.
I see. So we are seeing rates go up by double or 26% actually among people in their 20s. And I was quite curious as to what it's like in other countries, whether youth there realized how severe, of course, cancer is, but whether it's as common as to those in their 60s and 50s. So if you take a look at the screen, you can find out what our viewers had to share in regards to what cancer is like and whether it's that common among their generation. So Tasmia said, there are many types of cancer. Just eating healthily and exercising is not enough. People should get a weekly health checkup for any early signs of cancer, and that's what our medical experts taught us. Seyeon said, I noticed the rise of cancer among young people here in the United States. I'm working on eating more whole foods, reducing processed foods, reducing my exposure to plastics, and investing in more ways to distress. And Benny says, for me, I think of avoiding fatty foods and processed foods. So that's why I really think about trying to eat healthy food as well. So you can tell that in different parts of the world, whether it be the United States or in the Philippines, we are seeing a lot more people be aware that cancer is quite common even among the younger generation. And here in Korea, the most common type of cancer found among young people is colon cancer. And Walter, I remember doing an episode with you on this one, and though you are clean now and then you did have some symptoms that tick the box, why don't you walk us through just how common colon cancer is among Korean young adults compared to those in other parts of the world?
Yes, it is actually quite a scary looking statistic. So if we take a look at the screen, I can show you just where we sit amongst other countries, and it's also very scary for me because there are 2 countries there where I've lived in. So between the ages of 20 and 40, colorectal cancer, which occurs, is referred to as young colorectal cancer as well. There is a shocking result that South Korea is the world's highest in the onset of young colorectal cancer, according to research a paper done by the University of Colorado Medical Center team in the United States. The incidence rate of young colorectal cancer in Korea was 129 per 100,000, the highest among 42 countries surveyed, which is another terrible thing that Korea has to be on top of.
Exactly. And Hyojun, I hear that the rates are spiking up, right? Would you like to add more on that front?
Well, I was actually shocked when I found out this phenomenon here in Korea about the cancer. And I was able to look back on myself and my surrounding as well. Unfortunately, in Korea, the average incidence of the colon cancer patients in their 20s and 40s was also highest at the 4.2%. And colon cancer had a high incidence in the West in the past, but the incidence has been increasing rapidly in Korea since the 2000s. And the cause was found to be westernized eating habits and obesity, and chronic inflammations, overweight, and diabetes, and also delayed initial diagnosis due to the lack of awareness.
And I think that's the most saddening, because if you detect it early, there's so many different ways to treat it, especially with the advent of medical technology. But I do think a lack of awareness and also our eating habits does heavily cause a lot of people in Korea to have colon cancer, even though you're quite young. But to find out exactly how common colon cancer is and what we can do to better prevent it, we're now going to include a health expert in our talks, so stay tuned for our live interview. We're now going to turn to Dr. Alice Tan from Ms. Medi Women's Hospital. Welcome, Dr. Tan.
Thank you for having me.
All right, as a health expert, can you first diagnose how common colon cancer is among young Koreans compared to foreigners?
Well, in South Korea, according to the National Cancer Center, the age standardized rate for colon cancer incidence is 27.1 per 100,000 population. Globally, as you suggested previously, this rate is higher. The Korean rate is higher than the global rate. So globally, the rate is 19.5 per 100,000. However, we could perhaps say, fortunately, our country is not ranked in the top 10 for overall age standardized incidence of colon cancer. The countries that have the highest incidence overall for colon cancer are Hungary, Slovakia, and Norway, and they have age standardized incidence rates of all three of them greater than 40 per 100,000. Now, another metric that we should talk about with colon cancer, though, is mortality. So the aged standardized mortality rate for men for colon cancer here in Korea is 8.4, which is less than the global mortality rate, which is 9 for men. For women, also it's less. It's 4.6, the mortality rate, compared to the global age standardized mortality rate, which is 7.2. So there are some aspects of colon cancer in South Korea that are alarming. Overall, the mortality rate has been decreasing, however, in the recent past. And so I think we do need to pay attention to the increase in incidence among young people and try to figure out what's going on and what we can do to address this issue.
I think it's a great thing to hear that at least the mortality rate is decreasing and that we're becoming more well aware of this. But why are we seeing a surge in cancer rates from the younger generation globally?
Right. So this is a question that many people are asking. We are seeing a rise in what we call young onset cancer. So this is cancer that's occurring in people aged between 18 and 49. And we don't know the exact cause yet. Many scientists who are researching this, they suspect that it's a combination of causes. So perhaps lifestyle causes, such as you mentioned before, a diet that's heavy in processed or highly processed foods, not taking enough fresh fruits and vegetables in your diet, perhaps having too much exposure to known carcinogens such as alcohol intake, smoking, tobacco, pollutants as well. There's talk about the influence of the gut microbiome. So that's all of the trillions of bacteria that live in our gut. And an over-reliance on antibiotics could be changing the gut microbiome and causing increased inflammation in our body and increased tendency toward forming cancers. We're not exactly sure yet. There are a lot of smoking guns, however, and I think it's going to take time to sort of weed out all of the evidence that we have and try to figure out what's going on. And really, time is of the essence because, as you mentioned, we are seeing more and more cases of cancer among young people, and this is alarming.
Thank you for sharing your thoughts and info, Doctor. And how about what needs to be done to better raise awareness and prevent the cancer from the young age?
Well, having programs like this are very helpful, increasing the discussion just in society. I think the focus on actions to prevent cancer needs to start at childhood, at a young age. So parents and educators have a very important role in establishing healthy habits, especially related to diet, among young people. And then in terms of having them know to avoid exposure to known carcinogens, as I mentioned, alcohol and tobacco. UV light is another known carcinogen. On a government basis, we need to talk about air pollution, especially here in Korea. Today is a clear, sunny day, but in the spring we have a lot of days of very heavy air pollution, and so we need to take action on government levels to decrease exposure to air pollution. And then, of course, screening. So we have a good screening program in South Korea, but we need to maybe discuss lowering the threshold for screening colonoscopy. And right now, our primary screening is a fecal-based test, but perhaps having universal colonoscopy available for everyone starting at a young age is a way that we can prevent colon cancer among young people as well.
Dr. Tan, you mentioned colonoscopy, and I just have a personal question as well. There are a lot of stories, and with so much information online, sometimes we can't tell apart which one is accurate or not. But there are sayings that the younger you are, you don't really need to get a colonoscopy too early because that might be bad for you. But from what age would you recommend as a doctor for whether it be a male or female to get one? And also, are there any early symptoms for us to really detect colon cancer?
Well, so for the general population, we say to start screening at age 45. However, this is an individualized screening. So if a person is at high risk, in other words, you have a first-degree relative who has had early colon cancer, then we recommend screening 10 years before the onset of colon cancer in that first-degree relative. So if you have a first-degree relative who had colon cancer at age 45, screening for you should start at age 35. In terms of the risks of early screening, I don't really know of any risks for say colonoscopy other than risks associated with the procedure itself. The frequency of the screening really depends on what's discovered on colonoscopy the first time you receive it. So if there are many polyps, or the polyps are of large size, or the pathology comes back concerning, the doctor may recommend the next colonoscopy, the interval, to be 3 years or 5 years, depending on what the endoscopist finds and what the pathology shows. So it really is an individualized program that should be followed. But for the general public, screening should start at age 45. That's a recommendation in South Korea and also in the United States.
I see. And are there any symptoms that we might look after? Because we might not know that we have colon cancer.
Right. Many times colon cancer, especially early on, there are no symptoms whatsoever. But if there's any blood in the stool that you're noticing, any change in your defecation pattern, in other words, you notice a difference in the caliber of your stools, or you're having more diarrhea and you don't know why, any weight loss for unknown reason, any lower abdominal pain for unknown reason, these could be potential symptoms. And so you should bring this up with your doctor. And this is important for physicians to be aware of as well, that there is an increase of colon cancer among young people. So if a young person presents with these symptoms, perhaps 20 years ago, colon cancer would not even be, in our realm of possibilities. But nowadays it's different. We need to listen to these symptoms. If they do not resolve, then an examination for cancer should be considered.
All right. Thank you so much for your insights, Dr. Tan. That was a very helpful interview today.
Thank you.
All right. And ending off, I'd like to ask our panelists, based on your own research, how can we better prevent cancer, specifically colon cancer? Anything we can do in our daily lives, starting from changing daily habits to prevent any types of cancer, but also specifically colon cancer?
So obviously, listening to what the doctor said, there's a lot of things that opened my eyes, especially obviously the way of how we should also be raising our children to know about the effects of cancer. And though, obviously, God forbid that it ever happens to anyone as young as, a child, but it is good for them to at least understand that there is reasons why we have healthy diets. They're not just there because we don't want to, eat our vegetables or our fruits or whatever. There is medically backed evidence to suggest that eating a healthy diet will decrease the possibilities of contracting many sorts of cancers, not just colon cancer. For me, obviously, it's very hard, but it is something that I will try and do, and that's the consumption of processed foods. I'm sure you're very well aware of what that's like, Grace. That we love our processed food, but unfortunately, that is something that we need to look at if we want to take this whole thing seriously. So yeah, for me, it's going back on a healthy diet, working out, and those are the two things that I will be looking into a bit more seriously.
Yeah, because at the end of the day, I think today's episode made me really aware as to how common cancer can be, even colon cancer. And it's really scary because you don't really know the early symptoms at first. You have to go to a doctor and get a checkup and then find out. But sometimes it might be too late, so might as well use this episode to really look back at your daily eating habits, which I'm guilty of myself, but I will be trying. Now, Heejun, what about you? Any tips or advice as to how to be better attentive towards our health condition?
Well, I think the lower of the amounts of physical activities, the higher risk of the colon cancer. So office workers who sit and work all day, they need to increase their physical activities with regular exercises. And what I heard, the Korea Society of the Colon Cancer also recommended you need to exercise for at least 3 days in the week and at least 30 minutes at the times. And in addition, periodical health checkups are also important, I think. So because even if you're having healthy lifestyle, but if you can get the cancer anyways, so if it would be good to get the regular checkups at least 1 or twice in a year. And I also tend not to get the medical checkup if I get too sick, but I think I need to get the medical checkup since right now, and I also had recommended to our viewers as well.
And right now, the country is in a medical standoff between junior doctors and the government, which is making it much more difficult for us to go get regular checkups. But hopefully that situation is solved soon so that we better monitor ourselves and exercising on a daily basis. Not even all 5 or 7 days of the week, actually, just 3 times 30 minutes per day, and raising awareness that this story, unfortunately, could be yours. So just monitoring your health condition seems to be key. Now, in the meantime, we'll be here every day from 9:30 to 10 a.m. Korea time, bringing you more topics young people are talking about. Special thanks to Walter Lee.
Lovely to be here.
And Woo Hee-jun.
Have to be here.
All right, and thank you everyone for watching. We'll see you tomorrow. We are News Generation.